So good afternoon. This is Simeon from the Maryland Head Start Association. I'd like to welcome you to the meeting. And I'm going to be very short today. I just have two reminders. I want to remind you of the Return Ready seminar that the Office of Head Start is putting on for Region 3. It begins next week. So if you have not signed up, please make sure that you sign up now. I sent an email earlier today that it does include the link, and it includes the schedule for the entire week. It is a 4-week seminar, or I forgot what they're calling it, but it is 4 weeks. It's not every day, and it's not all day for the entire 4 weeks, but it is a 4-week program to discuss returning to school. So please make sure that you fill out that registration form and get yourself registered for the program. I also sent you included in the same email is a registration form for the Family Development Credential. The Family Development Credential is going to begin on July the 7th. It will be through distance learning. All right. So please make sure that you jump on that sooner than later, because there will be people who are trying to, who sign up for it. And we can only take about 12 individuals in the training. All right. So if you want to get your staff, or you have new staff, or whatever it is that needs to sign up for the training, please make sure that you sign up as soon as possible. Once we reach that number, we'll close. The registration is available until Tuesday, the 23rd at noon. And again, the training begins July the 7th. All right. And, once you sign up and register, you'll get all the information that you need to make sure that you can participate in the training. All right. So I don't want to take up too much time, because I want to make sure that you get this information here. We have Mr. Louis Valenti with us. He's the branch chief of licensing for the Maryland State Department of Education. And, he's got some information to present to us. So, Lou, I'm going to get your PowerPoint up, and then let you go ahead and take over.
Great. Thanks, Simeon. I appreciate it. Okay, it's good to be with everybody this afternoon. Thanks for having us. I have from our office, well, most of you probably know Tressa Hanna, but we also have our nurse consultant, Mangela Paul, with us, because a lot of times on these calls we get health questions that are answered by a nurse than by Lou. So thank you, Mangela, for joining us. I know you had a conflict today, and we're able to move things around so that you could join us, so I appreciate that. I recognize some faces. Some of you may know me from when I was a regional manager in Howard County, and then I was in Baltimore City for about 8 months, and I've also worked in Baltimore County. So I've been in a few of our regional offices. I recognize Yvonne. How you doing? Okay, we're gonna have about 28 slides to present today. We're not going to spend an amount of time on each one of these slides, because these slides were taken directly from MSDE's website, which are guidelines that are required to be reviewed by every program who wishes to resume operating, who was previously licensed. So I guess.
Give me 1 second. Okay. I don't know, for some reason I'm having a hard time getting it to come up. Let me.
Okay, I just want to ask a question. Are all of these programs currently closed and will resume operations? Is that where we are?
Yes, I think there's some programs who will be running a virtual summer program, okay. But the programs are closed. They may be offering food or other okay. remote programming, but children are not attending the classroom.
Okay, because one of the things that's not on any of the slides, so while we're getting that together, is that each program that needs to reopen We're no longer requiring applications to resume operating, but we are requiring that you complete a child care verification reopening form. And that form is basically to let us know that you are now open, because we've done a survey of providers to see how many of them will plan to reopen once this COVID crisis is over. There's been a lot of discussion nationwide about not all programs being open for children and that we're going to lose a lot of slots. We're finding that about 10% of our licensed and registered providers do not plan to reopen. We might lose that 10% permanently. So part of filling out this verification form and sending it to the regional office where you're located is to let us know that you are opening, and it's also a sign off that lets us know that you have read and agreed to follow these guidelines that have been developed with MSDE with the help of the Maryland State Health Department. So these things that we're going to go through today, again, they're all on our website. You need to be familiar with them, and you need to check them regularly, because as this first slide tells you, there are sometimes frequent revisions to these guidelines based on new information that comes out from the CDC and also from the local health departments, or from the state health department, which is filtered down to the local health departments. So these guidelines came from what has been posted as of June the 10th, which was only a week ago. So these are up to date. These are the current guidelines. But again, it's going to be your responsibility as a director to review the guidelines directly. We do try to send out an email to all of the license programs whenever there is a change, especially if there's a major change. There might be minor changes as we go along. There's nothing really going to be major. So, okay, next slide, please. Okay, the next two slides, this is just a welcoming message from Dr. Salmon, which talks to child care providers to thank them for the ones who have been opened as EPIC sites, which are for essential personnel. She wanted to thank them for operating, and for programs that closed for whatever reason. She also wanted to give thanks to them because we now are seeing it increase. Originally, Maryland licenses about close to 8,000 programs statewide, about 7,800. And COVID crisis, we had about half of those providers, just about 4,000 providers who agreed to be to provide care for essential personnel, because obviously nurses, doctors, people who work at the grocery store, they obviously had to get to work and they needed childcare. So we had about half of our programs who wanted to provide care to them. And of course, they had to do it at much reduced capacity because of group sizes that were established by the governor's executive order back in March, which made group sizes 10. And we'll talk a little bit about that.
What I called you for.
So basically, this slide says thank you from Dr. Salmon, and the next slide is a continuation of that. And again, she ends it by saying thank you for your tireless work on behalf of our families and children. Okay, next slide, please. Okay, this is an outline of events that have occurred as an MSD's response to the COVID crisis. Okay, so back on March 11th, the World Health Organization proclaimed this a pandemic. And Dr. Salmon closed all public schools in Maryland on March 13th. And she closed all child care programs on March 27th. 3 days later, we started accepting applications for essential personnel, and we established some EPSA sites, which were some school-age sites that were not licensed previous to that, to care for the children who were in schools. And as a result of schools being closed, these children needed somewhere to go. So those were established through our licensing offices, and our licensing staff, again, we reviewed 4,000 applications in a matter of days to get them up and running. Okay, so then in May 14th, Governor Hogan announced phase 1 of our recovery. And again, the recovery effort, as people go back to work, that's when childcare becomes more essential, because people cannot go to work if they don't have care for their children. So we began accepting new applications for these sites on May the 19th. Next slide, please. Okay, on May 20th, the recovery plan for education and childcare was released. If you want to look at those recovery plans, they are posted on MSDE's website, both of them. And in fact, one of these slides, if you transport children for your program, it's going to refer back to the Maryland's Recovery Plan for Education when it talks about transporting of children. That's not a specific childcare task. Okay, June 2nd, the governor announced phase 2 of the recovery. On June the 7th, which was just about a week and a half ago, the state stopped paying for the care of essential personnel and required parents to resume child care costs. On June the 8th, we began accepting applications for other programs who wish to reopen. We've been getting about 50 new providers per week who are showing an intent to open. We now have, I'm not sure the number of open programs right now, but more and more programs are opening every day. And then on June the 11th, after Dr. Salmon's announcement on television on her press conference with the governor, all child care programs are now able to be open. They do not have to fill out an application, but again, we are requesting that everyone fill out the verification of reopening form, and that's to let us know who and how many programs are operating, and as well as reading the guidelines that we're going to go over today and agreeing to abide by those guidelines. Okay, so next slide, please. Okay, now when your children are dropped off and picked up from your facility, parents are not currently able to enter your facility. Contact with the parents needs to be when the children are brought to the center, when they're dropped off. Staff should be wearing cloth face coverings worn by the parents, the guardians, and the child care staff when this happens. It is a requirement that you take temperature checks of all children who arrive. This temperature check should be completed by the parent, and it should be directly observed by the child care staff so that you can see that the parent has taken that temperature while they're dropping off. If they have a temperature, they should not be allowed in the program. Symptom checks are performed at arrival to include any symptoms the children, you want to ask the parents if if the children have had any exposure to anyone with symptoms, either at home or anywhere else. That's important information to know before you allow the children in care. Now, I know that one of the questions that often comes up when we talk about temperature checks is what type of thermometer to use. The parents really should be using a thermometer for their own child. Center should have a no-touch thermometer. I don't know, Mangela, if you want to speak to anything else about the thermometers that need to be used.
Yes, sir. Hi, good afternoon. This is Mangela Paul. I'm the nurse consultant for the Office of Child Care, and I have spoken with many of you in the past. I'm glad to be here with my boss. In reference to the temperature check, currently we are following the CDC and the State Department guidance that all children and all the staff who are entering into any licensed child care facilities, that would be your location also, will have to be temperature checked and symptom screened. We have the checklist for the staff to use it with the children's name and the temperature that is being measured on that day, and also the symptoms of COVID-19 that may be, that include fever, cough, shortness of breath, and any other related symptoms that are listed in the form. The reason for us asking the temperature check before the child or the staff enters into the facility is when the person has the fever, it is assumed that it may be COVID-19 condition. So once the person has the symptoms and enters into the facility, that person will be excreting the germs in the facility, and inadvertently the children or the staff may get exposed to. So that's the reason we would want them to be temperature checked before they enter into the facility. And if anyone has temperature of 100.4, that is the CDC and State Health Department given threshold, the temperature threshold 100.4. Anyone with 100.4 and above should not be admitted for the care. And the thermometers, we currently recommend non-touch or non-contact thermometer. That is the temporal one, the forehead one. It's just the infrared rays. When you keep in front of the forehead, it just measures the temperature within 5 seconds and the reading is given. So it's a non-touch temperature or non-contact thermometer or temporal thermometer that's being used. And these thermometers are the FDA approved products. So please make sure for your childcare or Head Start, when you are buying the thermometers, it is the FDA approved product that has passed the quality and safety standards from United States. Yes, boss.
Thank you, Manjula. Yeah, these temperature checks should be done before the child enters the facility. So different programs have devised different ways how to do that. One of the things is if you do have hand sanitizer at this temperature check station, just please make sure that that's out of reach of children. The hand sanitizer is extremely toxic to children. It's about 60% alcohol. So that definitely is fine for staff and parents to use, but not to be used for children. All right, so next slide, please. Okay, this slide says that we have an example of a daily log. Mangelo, will you be able to send that to Simeon and then he can share that with the directors so that they have a sample log of how, what symptoms they should be checking for and where to record the temperature?
Yes, I can send the guidance and the list to him.
Great, thank you very much. All right, next slide, please. Okay, now cloth face coverings. I'm assuming your children are ages what, 2 to 4 mostly?
3 excuse me, 3 to 5.
Okay, 3 to 5.
If we have early Head Start, then early Head Start is from pregnancy to 3, and then Head Start is 3 to 5.
Okay, yeah, because a lot of these regulations or guidances talk about different age groups, and we understand that. All right, cloth face coverings, adults, it is recommended that your child care staff wear cloth face coverings throughout the workday. Child care staff and parents should wear the cloth face coverings during drop-off and pickup time, especially during temperature checks. Parents and other adults who must enter the child care center should wear cloth face coverings while in the child care site. Now, again, basically, you should not be allowing parents into the facility, but we've received questions like, what happens if I have a plumbing issue and the plumber needs to come in? Well, they need to come in and fix things so that you can continue to operate, but those people also should be wearing face cloths. Now, these are the masks that personnel, healthcare personnel have to wear. These are face coverings. These are not masks. And we'll talk a little bit, there's a couple of more slides about face coverings. So next slide, please. Okay, children. Cloth face coverings should never be worn by children under the age of 2. So that's going to be any of your early Head Start programs. They should also not be worn by anyone with trouble breathing. Obviously, if they're unconscious or incapacitated, they should not be wearing masks. Some children, particularly those under age 5, so this is going to be most of your Head Start programs, may not be developmentally capable of wearing a cloth face covering without frequently touching it. So you have to just use good judgment on this. It's not a requirement. In fact, it's quite difficult to have children of this age wear face masks. And again, it's not a requirement, but if they can do it safely, then it's recommended. Some children with developmental or behavioral conditions may have difficulty tolerating face coverings. Obviously, children with respiratory conditions or other medical problems who would have difficulty breathing should not wear cloth face coverings. And any children with physical limitations who cannot remove a cloth face mask without assistance should not be wearing face masks, face coverings. So again, for this age group that you're serving, cloth face coverings are, it's up to the discretion of the staff and the parents, but the staff, it's strongly recommended that staff wear face coverings throughout the day. Okay, next slide, please. Cloth face coverings should not have any attachments that could be a choking hazard. It should not be worn if there's a strangulation risk. Face coverings should not be worn when children are napping. They should not be worn outside during outdoor play if social distancing can be maintained. And we're going to talk a little bit later about social distancing, because that's another very difficult thing to do in preschools. Children like to play together and get together in groups. We'll get to that. But children should not be forced to wear a cloth face covering if they are uncomfortable or unable to do so safely or show signs of breathing difficulty. Next slide, please. Okay, again, a face covering should be worn over the nose. I'm sorry? Okay.
No, I think that was some background noise.
Okay. Never be worn around the neck or the head, never be shared. They have to be stored properly. Now, we talked about this with the health department about once you take off a mask of a child, we don't allow plastic bags in cubbies in preschool rooms, so we did not want to store them in plastic bags, but they need to be stored in the child's cubby in some type of container or bag. Obviously, the face coverings need to be removed for meals and snacks, for nap time and outdoor play. If it becomes wet or soiled, it needs to be removed, or if the child is experiencing difficulty breathing. I don't know if we want to save questions to the end, or do we want to ask now if there's any questions about face coverings?
Can I just add one point, please?
Sure, please.
Face covering is, we have a guidance document, and I will share the guidance document with Mr. Simon. But the important point is face covering. If the parents are sending the children with face covering, the staff have to help them to have the face covering on during the child care hours. However, the children have to be helped to safely remove the face covering when they are napping, when they are eating, when they are taking snacks, or when they are in the playground, because during the physical exertion time, there will need to be more oxygen, and with face covering, children might feel suffocated and they may not be able to express that they need more air. So it is the responsibility of the staff to make sure that the children are safely removing and storing the face covering when eating, snacking, napping, and during playground activities time. It is not the requirement for the facility to provide face covering to the children. It's only the parents, when they send them with the have them face covering on.
I'm sorry, Mansfield. I think there is one more slide on face coverings. If we could go to the next slide, I think it talks about that they need to have the child's name on. Yeah.
Okay.
There's actually another slide after this as well on face covering.
Okay, Angela, you can continue. I'm sorry.
No, that's fine. No, this is the gist of the face covering information. So we just want to be sure that you do not have to provide face covering to the children. It is, you have to promote face covering if the children are sent with face covering. And children with special care needs like asthma or developmental disabilities or other special needs, please pay attention to them, because they won't be able to express the breathing difficulty that they are experiencing. But studies have shown that it is the adults who are excreting more germs, and we have to be safeguarding the vulnerable children whose immunity is still developing. So it is highly recommended that staff wear face covering during the child care activities, especially when caring for the younger ones or children with special needs, where 6 feet distance cannot be maintained.
Yeah, that's good.
Can I ask someone I think is on the phone, can you please mute yourself because you're coming through the presentation? Whoever is on the phone, please mute yourself. Thank you.
Great. All right. Yes, that's much better. Thank you. Yeah, the next slide, this talks about if you touch your face mask, if the children touches their face coverings, staff and children should wash their hands if they touch their face covering. Before and after removing a face covering, and the proper way to remove a cloth face covering is to use the straps. And if a child's unable to do that, then you need to reevaluate the decision for that child to wear that mask. All right, next slide, please. Okay, again, face covering should be removed for meal, snacks, nap time, and outdoor play. Placed in a clean paper bag marked with the child's name and date when removed. Multiple face coverings should not be put in the same bag unless they will not be used again prior to cleaning them. So you want to send those home in a bag with the child's name on it so that parents can clean them for the next use. All right, great. Thank you. Next slide, please. Okay, it's up to the parent to provide the face coverings for their children and to label them, clearly mark it with the child's name and room number or the teacher's name. Clearly mark to distinguish which side of the face covering facing outwards. That's if you purchase face coverings, that's pretty much tell. But if it's a homemade one, you need to know which side faces out. If parents supply surgical face masks rather than cloth face coverings, they have to be used according to the guidance given above. Okay, that's pretty much it for face coverings. So,
Lou, I have a question for you. What kind of experience have the Epic centers had with using the face coverings? For them in real.
Honestly, for preschool children, it's not widespread that they're using it. It's much more in use in school age programs. But again, it's going to be an individual thing for parents and centers to decide if these children are capable and able to wear face coverings. It really depends. So, you know, the director or the teacher can help make that decision with parents. But again, it's been shown that it really slows down transmission of disease if everybody is wearing face coverings. So it's definitely recommended if it's possible for the age group that you're working with.
I have a question.
Okay.
Hi, good afternoon. It's Olutande Clark. My question is, with the face mask being the responsibility of the parent, is that a function of, is that about minimizing risk to programs, or is that like optional? Because if folk were willing to take the responsibility to wash and clean them or blah, 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 is that okay, or are we avoiding risk?
Not sure I'm understanding your question, but is it
liability? Maybe the word is liability. Like,
okay.
I'm wondering if it's optional, if programs feel like I'm concerned that if I left it as parent responsibility, I'd have a portion of the population masked and a portion unmasked. Just because either folks didn't care or didn't have.
That's likely what you're going to have.
Well, so then I would probably then prefer to either like supplement those zones or just provide upfront to ensure that the full group was masked. But then I didn't know if you were saying it the way you were saying it, because if the program takes responsibility for masks, it's entirely possible that we somehow assume liability for.
Okay, no, the parent is required to bring the masks for their children. The centers are not supplying those masks. So if parents want their children to wear masks, they need to bring them, and not every parent's going to do that. And then if they do bring them, again, for this age group, if they're going to be touching the mask frequently or if they're going to be taking it off, it's just not going to be possible for them to keep a face covering on all day. So again, it's one of those things that parents are going to have to be on board with it, and the teacher is going to have to be vigilant in making sure that these guidelines, these recommendations are followed. Mangela, I don't know if you want to add anything to that.
Yes, sir. Imagine if we use the word mandated or it is required, then it will be back to us. Then would you be denying the admission to the child who is unable to wear the face covering? What determination you would make for the child to come with the face covering or not to come with the face covering? So that's one point. Then if you take upon yourself to provide face covering, how do you know the child's the breathing efforts? What do you know about what the children is going through with the allergy or respiratory problem? How do you know that that's the right face covering, the size and the material that is applicable to that particular child? So that will be a liability issue for you. So we are at this time, according to CDC and the State Health Department guidance, we are highly recommending and promoting face covering, but it is the parent's decision to send the child with face covering or not. For reason when the parents send the child with the face covering, the providers, the child care staff should support that behavior and to help them to have the face covering on, and also to help them safely remove it during mealtime and other time. And childcare providers have a successful experience with the children. One childcare center, bigger center, they said that in the morning when the children come with the face covering, they have a small group talk why they have the face covering and what time, when should they call the teacher if they have any difficulty in breathing. And that constant reminder helps the children to understand the value of the face covering and then when to contact the teacher to have it removed. And also we heard that when the teachers are not well prepared and not well informed about the importance of face covering, and they think that, oh, everyone has to wear it and this is the requirement, and then they become more anxious and maybe hard on the children and be angry or raise their voice. That might become the different issue later on. So we have to be very careful in enriching the positive behavior in the children of importance of wearing face covering safely. And also as the teachers and providers, we have to be educated the importance and then having the conversations with the children to promote that behavior and also to test our emotions all the time to make sure that we are providing positive environment to the children. Yes, boss.
Hi. Hello, this is Mary Gunning. I'm from Baltimore City Catholic Charities Head Start. I have a question. So we all know that the face masks are primarily or more of a protection for other people than they are for us. I'm just wondering, is there any anecdotal information from the EPIC centers? I mean, if I'm a parent and I'm requiring my child to wear a mask and 4 other children are not, do you have any information how that went at centers? Because I could see that being a concern for parents, and I know we can't mandate it, and I understand that. Just wondering if there's any anecdotal information.
Mary, I actually have not heard that as an issue, and we do I talk to the regional managers and supervisors every single day.
Okay.
That has not been an issue as far as I've heard. Mangela, I don't know if you've heard anything about that.
Not as a concern or issue.
Okay, so I have one more question. And again, I understand parents need to provide their own masks for their children, and I, see the potential liability around if they don't. However, in our Head Start population, we have children, for example, that sometimes don't have sheets for their cots. So we provide that. So, but you're saying under no circumstances, I mean, could we give parents masks if we want to bring, or should we just stay out of the whole mask thing?
You can make your own policy and guidance and get that approved by your administration. We can
Okay,
provide you the CDC guidance and the state health department guidance. But if you want to be more stringent with the guidance, you can develop your own policy and get that approved by your administration.
Thank you.
Yeah, and if you're going to use masks that you supply, they of course also have to be labeled with the child's name, so they're not mixed up with any other child.
Sure. Thanks.
Okay. Okay, if there's no other questions about face coverings, we could go to the next slide. Okay, social distancing. Okay, recently we had a limit on the number of children who could be in a group. The governor's executive order issued back in March limited the number of people in a group, including staff, to 10 people, which meant there could only be 9 children in a group with a teacher. The governor recently changed that to 15 individuals. So that means 14 children with one teacher for ages 3 and 4, and school age children also. It actually doesn't say that, but that includes school age children also. It's a temporary relaxing of the regulations where we allow up to 14 children with 1 teacher, but the same ratios that are currently in existence for 2-year-olds are in effect. So 2-year-olds, it's still 1 to 6 with a maximum group size of 12. So if you have 12 twos, you still would need 2 staff because that would not exceed the 15 individuals per classroom. The next 2 bullet points are about family child care that we don't need to have in this discussion. Child care programs must adhere to the group size allows for the age in their licensing regulation. Groups and rooms are restricted to no more than 15 people. And again, that's children and staff. So I know usually the Head Starts that I was familiar with usually had 17 or 18 children in them. In this case, it's going to be limited to 14 with 1 staff person. If you have 2 staff people in that room, it's going to limit it to 13 children. Okay. Next slide, please. The facility is attempting to maintain at least 6 feet between children and staff when direct care is not required. Now, I've been seeing a lot of interesting things online about how child care centers are attempting to do social distancing with preschoolers. And again, it's a very difficult thing to do, but they've been giving them like individual tasks at tables and whatever that task is, whether it's coloring or something. They have been able to, at least for part of the day, keep social distancing as much as possible. We want you to limit the cohorts of children and staff at one time. So basically, your one group of children with that teacher, they should be using the facility, the restroom facilities at the same time. They should be using the outdoor playground at the same time. If possible, you must sanitize the bathroom between different groups. So if you have shared bathrooms between different classrooms, you want to use it for one classroom, sanitize it before you use it for the next classroom. Mangela, anything to add about social distancing?
No, sir. Like the CDC has given the guidance with the reconfiguration of the classroom to make sure that the 6 feet distance is maintained. That is scientifically proven that it does prevent exposure to the COVID germs. And when the 6 feet distance is unable to be maintained, it's a requirement for face covering, especially for the adults.
Thank you. All right, next slide, please. Okay, playground use. We had a lot of discussion with the health department regarding this. There were no real guidelines for playground use, but basically you can use the outdoor playground if you maintain your groups. We want to keep one classroom at a time outside. If you have a very large playground and you can keep your groups together, it may be possible to have 2 groups out there at the same time. But basically, you should be cleaning and sanitizing the equipment between uses of different groups of children, and children should wash their hands after playing outside. Now, some of the questions that I don't believe are on these slides, it might be later, I'm not sure, but we've been getting questions about sprinklers and water tables. The health department has recommended that a water table can be used by one child at a time and should be cleaned and sanitized between uses. And sprinklers outside, that doesn't appear to be a high risk activity, so sprinklers can be used for outdoor play. Next slide, please. Okay, if the playground's material or configuration make it difficult to clean and sanitize, or if social distancing cannot be maintained, then you should not use the playground. Okay, and there's the thing about water tables, one at a time and clean between uses. Next slide, please. Okay, field trips are not permitted at this time, and we have been getting questions from child care centers if they can do this. No, not yet. A lot of places aren't even open, like the zoo and things, but right now, no field trips. Outside vendors and guests are not permitted at this time because, again, you have to maintain the appropriate group size. So we don't want you to bring in people like puppeteers or people who read to the children. All of those things are fine in normal times. Unfortunately, these are not normal times, and hopefully we can get back to that at some point, but not right now. Okay, do you transport children for your Head Starts? I assume that that happens sometimes.
Yes.
Okay, yeah, the guidelines for transporting children, it says to refer back to Maryland's Recovery Plan for Education and not for child care on pages 21 and 22 for transportation. I did take a look at that. There's really not a lot of information there on guidelines. It basically states to social distance on the school bus. But it doesn't really say anything more than that. It doesn't even say anything about cleaning the seats on the bus or whatever, but take a look at that. It's on Maryland's website. It's one of the first things that you will see when you go to marylandpublicschools.org.
But I'm sure some of you must have attended the presentation this afternoon with Head Start conducted the webinar on transporting children. They basically said, again, 6 feet distance, even inside the bus, cleaning before entering the children, and then after the children are exit also to cleaning, and then how to have the car seat, and how to clean the children's hands when they are in the transportation. All those slides are available on your website, and it was a great presentation this afternoon between 1 to 2 by the Head Start program this afternoon. So you can refer to that also.
Great, thank you. All right, next slide, please. Okay, now your programs, do you have food delivered? How does that work for Head Start?
Every program is a little different, but yeah, sometimes it's food delivered. Some programs prepare the food.
Okay, well, then we can go through food prep and meal service. If a cafeteria or group dining is used, serve meals in the classrooms instead. If meals are typically served family style, you should plate each child's meal to serve those children so they're not using the same utensils. So if family style is not recommended at this time because that requires that they touch the same bowls, the staff should be serving out of those containers. Food preparation should not be done by the same staff who diaper the children. Sinks used for food prep should not be used for any other purpose. Caregivers should ensure that children wash their hands prior to and after eating, and that's regulation. Caregivers should wash their hands before preparing food, and that's regulation. Okay, next slide, please. Okay, cleaning, disinfecting, and sanitizing. Okay, cleaning should be done with water or cleaning product and scrubbing. Cleaning does not kill the bacteria, so sanitizing does. So the sanitizing and disinfecting products are chemicals that kill the germs. Disinfectants kill more germs than sanitizers. In most cases, a cleaning product is used first, and then the surface is sanitized or disinfected. And I think the next slide talks about typical things that you can buy over the counter to clean and sanitize things are acceptable. You should clean surfaces multiple times during the day with an emphasis on cleaning and disinfecting frequently touched objects and surfaces. Toys should not be shared between different groups of children. You should have the same toys in each group of children. Toys that cannot be cleaned, they're talking about things like stuffed animals and things, they should not be used. You need to use toys that can be cleaned and sanitized. That should be done multiple times each day or after each use when appropriate. Okay, next slide, please. Okay, how to clean and disinfect surfaces. Detergent and soap and water. EPA registered household disinfectants should be effective. A list of products are, I don't know if that link on this PowerPoint works, but there is a list of approved cleaning and sanitizing things. Follow the manufacturer's instructions. Okay, now the bleach water solution at the bottom of this slide has changed slightly from what's always been recommended because of the virus. It's a little bit stronger now. The bleach solution should be 5 tablespoons of bleach per gallon of room temperature water, or 4 tablespoons of bleach per quart of room temperature water. And again, that's a little bit stronger than the typical bleach solution that you may have been using in the past. All right, equipment and supplies. This is just things that should be on hand. Let's see. You're not required to have N95 masks. You should have cloth face coverings or surgical masks. Next slide, please. Okay, now, if you have, and we have had, I don't want to say many, but we have had to deal with programs who have cases of COVID. We've had centers that had suspected cases of COVID. So this is what you must do if you have a child, a staff person, or a parent who has accessed the facility who has had exposure to the virus. You must immediately contact your licensing specialist and your local health department. So whatever jurisdiction you are in, if it's Baltimore City, you must contact the Baltimore City Health Department or the local county, whichever county you're located in. Now, the local health department has received guidance from the state health department, on when programs need to close and for how long. So if the health department, the role of the licensing specialist in this is to gather as much information as they can from the center director, who was exposed, how they may have been exposed, if the person has been tested, if they need testing. So the licensing specialist must be notified, and that actually is a part of regulation where it says you must notify the Office of any communicable disease. So you must contact us and you must contact your local health department. Cases are evaluated on the level of risk. Closures and reopening decisions are made on a case-by-case basis. We've had, for instance, if you have a child with a suspected case of COVID that might be running a fever, you might need to close your facility or at least room that the child has been in until that child has been tested, and then wait for the results to come back before a decision is made if you need to stay closed or if you can reopen. You must keep in close communication with us and the health department so that decisions can be made about those closures. Parents need to report any illnesses within their household to you during your symptom screening at drop-off time. We need to know if children have been exposed to this virus. As you probably all know, this virus is still out there. It's not going away. In Maryland, we are very lucky that our case numbers have gone down recently, but the virus is still out there. And just on a personal note, I was at the beach last weekend and there were a whole lot of people who were not socially distancing or wearing masks or doing all of the things that's recommended to keep the spread of the virus down. So it's still out there and it's still, people still get sick. So Monitor your absences among children and staff according to the guidance. We want to see if children are out for long periods of time. We might need to find out why. Next slide, please. Okay, for the purposes of this guidance, a probable case of COVID is a person, whether it be a staff member, a child, or another person that has symptoms, regardless of whether or not they've been tested or if the test results are not yet known. So people can be possibly exposed without positive tests. A child care program should close if there is a laboratory confirmed case of COVID or probable case who was present in the program within 48 hours prior to developing COVID symptoms and has had close prolonged contact as defined by the CDC with the program or staff. Again, you will get guidance on whether or not you need to close based on information that is obtained from the licensing specialist and the health department. The health department, the licensing staff will not tell you that you need to close. That will come from your local health department. The center should close if there is a confirmed COVID case, even if it's asymptomatic, if it was present in the program building and had to close prolonged contact as defined by the CDC. So again, you may have to close even if somebody is tested positive that was asymptomatic or someone who is sick and has to be tested. If the person with a confirmed or probable COVID case is a parent or a child, we need to determine if they've had close prolonged contact with center staff. So again, these are questions that we're going to ask you if you find that you have a child who is sick or a staff person who is sick, or even if you have a parent who shows up who might have symptoms. So we will be asking you lots of questions and referring you to the health department for guidance. Next slide, please. Okay, contact us again, children affected. Okay, children, this is important. Children that are affected by a child care program closure due to a COVID case, they need to quarantine at home for 14 days. They should not seek child care in an alternate program. We don't want children who may have been exposed to go into another facility where they might expose others. So we will be in touch with you, and the health department will be in touch with you that these children really need to stay home and for 14 days and not go somewhere else. Child care program staff should also quarantine at home for a minimum of 14 days. And again, we hope that doesn't happen in any of your programs, but we have 4,000 programs that are currently operating. We've had, I don't want to give you a specific number, but we've had over 50 cases of either suspected cases or confirmed cases in child care settings, and some centers have had to close temporarily, and the reopening guidelines come from the health department. So it has happened, it does happen. The development of symptoms in the program's children, parents, and staff should be monitored by the program. Yeah, if a program is closed, we are going to contact you for updates on that child or the sick person so that we can help the health department make a determination of when you can reopen. So next slide, please. Simeon, what slide are we on? I think we have 28 total.
We are on slide 28. Yeah, and then the next slide is a slide of contacts.
Okay, yeah, and that's for Western Maryland. That's not going to be helpful. Okay, so this is going to be the last slide before questions. The length of time for closure is determined by the health department in consultation with the Office of Child Care. Closure can be shortened if results of a test are negative, and it may be longer if a person has to be quarantined for 14 days. So yes, we have had instances where programs had to close for up to 28 days where the child had to quarantine for 14 days and then another 14 days had to be added. That's unusual, but it's possible. Reopening decisions and approvals are made on a case-by-case basis. And then it tells you the difference between isolation and quarantine. And isolation separates sick people from others, and a quarantine not only separates them but restricts their movement. So that's really our last slide for this presentation, and we will be happy to answer questions. We only have about 3 minutes left, but I think if you guys can stick around, we can certainly stay if you have some questions for us.
I can just add to the closure guidance. We have posted the contact information for the local health department on our website, and I can also share it with Mr. Simeon so that you can send it to your Head Start programs for them to contact the health department if they have any child or staff or parent who may have possible COVID cases to report to the health department right away. It is to your benefit and also for the children. Please make sure you do not mix the groups from one classroom to the other classroom, as well restricting the teachers to stay in one classroom for the entire operation, and also assigning a designated person to relieve them for lunch or breaks. That will help us in partial closure. We don't have to close the entire facility. We can just partially close part of the room, not one room, not the all classrooms. If we know like number of people who stayed in that room, including the teachers in that classroom. It is very, very important that you contact the health department and the assigned licensing specialist. And I will send the contact information with other documents so that you have it in hand to contact the health department.
Yes, great, Manjula. That's great. Yeah, we'll share what we can with you, and you all can have that. If you need any of that information in the future, all of that information is posted on our website. At the top of the Division of Early Childhood's page on the website, there's a yellow bar that says COVID-19. You can hit that bar and it'll bring up a whole list of resources for you, for parents. So we actually have a website regarding the COVID crisis, because we've worked very closely with the health department to develop some of these guidelines. So that information is there. All right, any questions for us today?
I have a question. This is Sheldon. Will this information be accessible after this meeting in terms of this PowerPoint, or is this already accessible on MSDE's website, Simeon?
Yeah, so I've recorded the presentation, and I'll send you a link of the recording. And with that link, I'll send you any other information that's sent to me along with the PowerPoint.
Thank you.
And that'll be sent out to everybody.
Thank you.
Once you decide to reopen, how far in advance do you have to report to the Office of Child Care?
Okay, again, the decision to reopen if a site is closed comes from the health department. We have
No, I didn't mean if they were sick. I just mean as Head Start stop and reopen, how notice do they give to their licensed professionals?
Are you planning on opening in August? What's the school year? Is that when they open generally?
Generally, I don't know what anybody's plan is for this school year.
Okay. Well, again, basically what I would say is it's not really taking us very long. What we have to do when we receive the verification of reopening form, we just call the program and go through the checklist that, yes, I have read all of these guidelines and agreed to abide by them, and that can be done fairly quickly, in a day or two. But if you're planning on reopening, I would suggest getting your verification form in now, getting that process taken care of, and then we can add you to the list of programs who plan to open or be open. And you can certainly let us know when you send us that verification form what date you plan to reopen, because that's also helpful.
Okay, and it doesn't matter if that date gets pushed out as we go forward.
No, we understand that happens sometimes.
Okay. if a program is going to be using teachers in the classroom to virtually teach the children who are off, do they need to reopen?
I'm sorry, Tressa, what was that? If they're going to do virtual teaching?
If they're going to do virtual teaching to the children from their site.
Yeah, I mean, that's fine, but what was the question? If they are?
So should they fill out that verification of reopening?
I would say yes.
Okay. Okay. And then if they're just having like a couple kids on board, then they would do it for sure. Okay.
Yeah, because basically that form, again, is to help us know who's operating. A lot of people, we have got responses that some people don't plan to open until January. Some, everybody's different. Everybody has some different decisions to make about, especially for family child care providers, their family and their concerns, and we understand that. But yeah, if programs are going to operate, we would like to know that. So get us the form in.
Okay, thank you.
All righty. All right, guys, thank you very much. If you have questions, contact your licensing specialist in your region. The regional managers are also available. They have all been working virtually. Again, we are doing, let me just say this, we are doing virtual inspections of programs that are currently operating. And as part of the virtual inspections, we're checking basically for two things. We're checking to see if people are following the safety guidelines that the health department has established. And for our purposes, for regulatory purposes, we're looking at group sizes to make sure that the group sizes are not exceeding the 15 limit. And then the safety guidelines for cleaning and sanitation to make sure that you have cleaning products to sanitize. So that's what we're doing now virtually. Again, as schools reopen in the fall and teachers go back to work, we suspect that licensing staff will also be going back to work and doing inspections. But if you have an inspection, if your anniversary has been in the last 3 months or it's coming up soon, you will likely have a virtual inspection from your licensing specialist. And unfortunately, most of the time during these virtual inspections has to do with technology and not with the actual inspection. It's getting everybody to be able to use Zoom or not Zoom. We're not allowed to use Zoom as a state system. But the technology piece, once we get that up and going, the actual inspection doesn't really take too long. We are accepting electronic signatures on those. And we will get you out a copy of that. Once we get back to the office, we cannot print out those inspections at this point. So there's things that we're all working on. And again, don't have a date for you at this time when we're going to be actually doing in-person inspections.
Lou, I have another question. This is from Dr. Bowen, and he runs the Shore Up program on the Eastern Shore. He's wondering, do we need to do the verification for each center location or
Yes,
for the whole program?
We would like one for each program, please, because once we do return to the office, we would like to place that in each file.
So each site that there,
Yes.
so if a Head Start has 32 sites, you need something for each of the 32 sites.
Yes. They're separately licensed, is that correct?
Yes.
Yes.
Yep. We would want one for each. Yes, please.
Lou, this is Yvonne. I have a question.
Uh-huh.
And it actually goes back to the beginning of the script, the slides. I think on the first slide, there was a, you said you were going to send us, I guess there's some things you're supposed to check on the child each day when they come.
Yeah, the symptom check.
Right.
Yeah,
can
Angela's going to send that.
Right. So can we keep that symptom check electronically, or does it have to be on a piece of paper?
I'm fine with it electronically as long as when we do an inspection, you'll be able to show it to us.
As long as we can print it out.
Yeah.
Okay. Some of the databases can handle, do have that next to every child's attendance. You can customize a checklist. So, okay, thank you.
Okay.
Okay. Thanks, Lou. Thanks, Angela. It was great to see your smiling face.
All right, guys. Thank you all, and good luck and stay safe, everyone.
All right. Thank you.
All right.
Thank you.